So in many ways, it kind of may seem like this is out of the clinician's control, but like, what do you see the role of the clinician or healthcare provider playing in this opioid epidemic, especially in the grand scheme of this pandemic, where there's so many external factors at play?
Well, we've seen this, that initially it was very difficult to access healthcare practitioners, physicians, for example, because everything was closed. Over time, though, offices have opened. We have a great deal of advantage now related to remote telemedicine, for example. So telemedicine has really been very helpful. Telemental health services are now on the rise for those in need. So as a practitioner, I think that it's important to advocate to patients that they have connections that are available online via telehealth, telemental health services, which is important because a lot of what you see in terms of addiction is related to a lack of communication and a feeling that you're alone, you've lost control. Well, I think that some of that can be regained actually due to telehealth services. The other thing we've learned is that there are certain medications. They're called medication-assisted treatments, also known as agonist therapies. These are medications like methadone, buprenorphine, Suboxone. Well, certainly buprenorphine can be prescribed by telephone now and can be prescribed via telehealth. That wasn't the case in the past, which is helpful. Methadone in certain cities also actually has mobile services related to it. So if you can't get out, you can't get the methadone, at certain clinics, it can be delivered to you. And these medications are critical to maintaining sobriety, preventing relapse.
So what is the potential outlook for this issue? I mean, I know it's maybe too soon to tell, but especially if most states continue in some type of lockdown, from your perspective or opinion, what do you see the kind of where we're headed now? Like, what do you see this potential or outlook being?
I think there's hope because of what we learned from the initial stages of COVID-19 when everything was closed. Things are open. Even if you can't get to an office, a practitioner's office, you can reach out to him or her via telehealth services. That's important. You can also reach out to support groups, 12-step programs, for example, via Zoom, other remote opportunities. I think we've also learned about the importance of Narcan. Naloxone is the other name for that. It's an opioid reversal agent. It saves lives. We're not seeing enough of that being disseminated. The visibility isn't there yet, across the population in the United States. I think that we could certainly improve communication related to the importance of that drug for people who are abusing opioids, or going to the streets, because it'll save lives. It's important to know that practitioners can prescribe it. Pharmacists in certain states can also provide it without a prescription. And law enforcement also can disseminate it. So I think naloxone is important to realize. It's available. Use it for family members, friends of those who have the disease of addiction. And also be aware that there are fentanyl test strips. These are little strips that you can use to determine whether fentanyl, as we talked about, the synthetic opioid, has been laced or has been added to street drugs, like, for example, methamphetamine or cocaine. You can take a little bit of that cocaine, you can take a little bit of that methamphetamine and put it in some water, put a test strip in there, and if it's positive, then it tells you fentanyl has been added, and I would say stay away because it could easily lead to death.